children diagnosed with autism continues to climb, and so do the questions surrounding this disorder. With us this morning is Dr. Fred Perkins, a pediatric neurologist with Dell Children's Medical Center. Thank you so much for coming this morning.
Thank
of course,
you.
the timely aspect of this is a conference coming up here in Central Texas.
Yes.
Dealing with autism. Does this happen each year?
Yes, it does.
Okay.
It was one last year, and this will be our second one.
And you're going to be speaking at that event. Start us off by telling us, why are the numbers growing?
That's an excellent question, and there isn't a simple answer to it. The major issue seems to be that there's improved awareness and improved diagnostics. So we're picking up more children who are on the spectrum as compared to previously. The other issue, though, is that we are not entirely sure that that accounts for all of the increase in diagnosis, which would imply that there could be environmental associations, but none of that is proven.
Mm-hmm. How do you pinpoint this is autism?
That's another excellent question. So first, it's a clinical diagnosis, and it starts usually with a parental concern about development. Autism is usually characterized by three major things, which are sort of language delays, socialization delays, and a tendency to have like fixed stereotype behaviors or hyperfixations. So this starts off with families going to the pediatrician, and then either referral to, say, a pediatric neurologist like myself, or a developmental pediatrician, or a psychologist or a psychiatrist. Then, based on the diagnostic criteria, we can often make the diagnosis in the office. If that's not sufficient, or there's still questions, you can do more detailed neuropsychological testing with autism surveys, which gives us sort of a more fully developed picture of where this child's development is.
Mm-hmm. Is there new research out there or coming down the pike?
Well, probably the most exciting thing we have going on right now in Austin is that we are working towards acquiring a new brain scanning technology called MEG, which is magnetoencephalography. This will be installed at Dell Children's Medical Center, and this has already been used in other centers to look at brain development. It has other implications for other disorders as well, including epilepsy and brain tumors and such. But what it can do is give us insights into how the brain of an autistic person works without doing invasive things.
Mm-hmm. Huge for Dell Children.
Yes, we would be about the 6th children's hospital in the country to acquire the technology.
Wow. So let's get back to this conference. What is the goal of the conference, and who can come?
Excellent question. Well, first of all, the goal is to increase awareness, understanding what the latest diagnostic criteria are, what treatment options there are. As far as who can come, it's open essentially to everybody. It's geared towards both medical professionals and to parents.
Wow. And where is it going to be?
It's going to be at the Sign Auditorium, which is on the Dell Children's Hospital campus on February 2nd.
Got it. Dr. Perkins, thank you so much for being here this morning. Some good information.
Thank you. My pleasure.
For all of us.